Hello, everyone. I'm Dr. Benton, a physician specializing in senior health. After more than 30 years working with older adults across the United States, I have learned one powerful truth. The strength of your legs directly determines your freedom and quality of life. Have you ever felt uneasy walking down the stairs? Do you hesitate to take an evening stroll because you fear a fall? Those concerns are not simply normal aging. In many cases, they stem from nutritional deficiencies, an issue we can absolutely prevent. Today, I'd like to guide you through 7 essential vitamins and minerals that keep your legs strong. These nutrients are proven to fortify bones, enhance muscle power, improve balance, and protect the nervous system. When you get enough of them, you can walk with confidence, with less pain and fewer cramps. Keep joints flexible and bones resilient. Lower your risk of dangerous falls and fractures. We'll look at each nutrient in depth, how it works, the best food sources, recommended amounts, and how to fit it into everyday life here in the U.S., where many seniors spend little time in the sun, eat quick meals, and often take medications that affect absorption. 1. Vitamin D. Sunshine for bones and muscles. Role. Vitamin D helps your body absorb calcium and phosphorus, critical for bone strength. It also activates muscle proteins that maintain quick reflexes and muscle power. Low vitamin D leads to weak legs, difficulty standing up, and slower reactions that increase fall risk. U.S. reality. Nearly 40% of Americans over 65 are deficient, according to the Journal of Clinical Endocrinology and Metabolism, because aging skin produces less vitamin D, and many people spend little time outdoors. Solutions. Sunlight, 15 to 30 minutes in the morning or late afternoon, at least 3 times a week. Foods. Salmon, mackerel, sardines, mushrooms, eggs, fortified dairy or plant milks. Supplements. Most seniors need 800 to 1,000 IU daily. Higher doses may be prescribed after a blood test. Dr. Benton's tip. If you use sunscreen, give your skin 10 to 15 minutes of sun exposure before applying it to boost natural vitamin D production. 2. Calcium, the foundation of strong bones. Why it matters. With age, bone renewal slows. Too little calcium makes bones porous, raising the risk of osteoporosis and hip or leg fractures, injuries that can threaten independent living. Muscle impact. Calcium is the switch that allows muscle fibers to contract and relax. Deficiency causes cramps and muscle weakness. Foods to enjoy in the U.S. Low-fat dairy, dark leafy greens, kale, bok choy, collards, almonds, tofu, canned salmon or sardines with soft bones, and calcium-fortified plant milks or orange juice. Recommendation: 1,000 to 1,200 milligrams daily, primarily from food. If you supplement, pair calcium with vitamin D for better absorption. Weight-bearing activities like brisk walking or light resistance training help calcium lock into bones. 3. Vitamin B12, protecting nerves and reflexes. Function. B12 supports the myelin sheath, the protective insulation around nerves. Without it, nerve signals to the legs slow or misfire, causing numbness, trembling, and unsteady steps. Why seniors lack it. Aging reduces stomach acid, making B12 harder to absorb. Acid-reducing medications can worsen the problem. Sources: lean meats, fish, eggs, dairy, and seafood, especially clams and liver. Vegetarians should look for fortified cereals or plant milks. Supplements. If a blood test shows deficiency, doctors may prescribe sublingual tablets or periodic B12 injections. It's water-soluble, so overdose is rare. 4. Magnesium, the muscle relaxer. Benefits. Magnesium regulates muscle contraction and relaxation, eases night cramps, supports bone density, and steadies heart rhythm. Many of my patients report nighttime leg cramps disappear within weeks of correcting a deficiency. Common causes of low magnesium: diuretics, acid-reducing drugs, chronic stress, and diets low in nuts or greens. Sources: spinach, avocado, pumpkin seeds, almonds, black beans, whole grains. Supplements: magnesium citrate or glycinate are best absorbed and gentler on digestion. 5. Potassium, balancing fluids and strengthening bones. Role: potassium maintains nerve signaling and fluid balance in muscles. Low potassium can cause cramps, trembling, and higher blood pressure. Sources beyond bananas: baked potatoes with skin, sweet potatoes, avocados, oranges, lentils, spinach. Needs: about 2,600 milligrams daily for women and 3,400 milligrams for men. Anyone with kidney disease or on diuretics should consult a doctor first. 6. Vitamin K, guiding calcium to the right place. Main job: vitamin K directs calcium into bones instead of arteries, keeping bones strong and blood vessels flexible. Extra benefits: reduces knee inflammation and supports muscle coordination. Vital for balance. Sources: K1, dark leafy greens such as kale, spinach, Brussels sprouts. K2, fermented foods like natto, aged cheeses, liver, egg yolks. Note: if you take blood thinners, like warfarin, speak with your doctor before increasing vitamin K intake. 7. Vitamin B6, fuel for muscles and red blood cells. Action: B6 helps create red blood cells, which carry oxygen to muscles. Without enough, muscles tire quickly and recover slowly. It also supports nerve communication and reduces muscle inflammation. Sources: turkey, salmon, tuna, bananas, potatoes, chickpeas, fortified cereals. Intake: around 1.5 milligrams daily for women and 1.7 milligrams for men. Avoid high-dose supplements long-term, as excessive amounts can affect nerves. Lifestyle tips to maximize these nutrients: stay active. Walking, light weights, yoga, or gentle cycling strengthen bones and muscles. Regular checkups. Blood tests for vitamin D, B12, and potassium reveal hidden deficiencies. Maintain a healthy weight. Excess weight and smoking or heavy alcohol use reduce nutrient absorption. Hydrate. Even mild dehydration can cause cramps and reduce blood flow. Dr. Benton's closing message: age does not have to mean frailty. I've seen patients well into their 80s walking confidently each morning because they focused on nutrition and movement. Start small today. Add an extra serving of leafy greens. Spend 15 minutes in the morning sun. Ask your doctor to check vitamin D and B12 at your next visit. Simple steps like these will protect your legs, the very foundation of your independence, joy, and freedom throughout your golden years. Stay strong and keep moving.